Hi, my name is Brittany Shannon.
Hi.
And I'm going to be your occupational therapist today.
Okay.
Now, I heard the reason you came in is because you had some elbow pain and some swelling, and they diagnosed you with something called lateral epicondylitis. Is that correct?
Yes, ma'am.
Okay, so you've also been having problems just moving that arm up, washing your hair, doing things like that?
Mm-hmm.
Okay, so I think the best treatment for us to do today is going to be something called Iontophoresis.
Okay.
And what this does is this puts a medication in your arm through an electrical current. And that medication will decrease that pain and that swelling. And it does this without a needle, so your risk for infection is decreased.
Okay.
Now, there is a slight risk for burning, but that risk is very low. We're going to be monitoring you the whole time. And you just tell me if you feel anything like that, and we'll take it off.
Okay.
Does that sound like something you want to do today?
Yes, it is.
Okay, perfect. And then after this, we'll teach you some other strategies you can use. And hopefully by doing this, that'll decrease all the pain and swelling so you can get back to doing those things like brushing your hair, washing your hair, moving that arm around. Okay? So I just have to ask you a couple questions first to make sure that this is appropriate. So can you tell me your name?
Megan Martin,
Okay. Can you tell me where we are right now?
the University of St. Augustine.
Perfect. And can you also, I just want to take a peek at your arm where we're going to be doing the treatment on, okay? Perfect, okay. Now it is important for you to know if you do have any cuts or bruises, you don't want to do this treatment because that increases that risk for burning.
Okay.
And I also want to check your sensation. So what I need to do is I'm going to roll this sleeve up. I'm just going to run my fingers down your arm. I want you to close your eyes and I want you to tell me if it feels the same or different, okay?
Okay.
So does that feel the same or different?
Same.
Same or different?
Same.
Same or different?
Same.
Okay, perfect. And now I just have a couple other questions. So do you have any allergies that you know of to dexamethasone?
No.
Okay. What about any allergies to ions?
Mm-hmm.
Okay. Any other severe allergic reactions you've ever had to anything?
Nope.
Okay. Do you have a defibrillator?
No.
Do you have a pacemaker?
No.
Okay. Do you have a bladder stimulator?
No.
Any other phrenic nerve stimulator that you know of? Okay, great. Are you or could you be pregnant?
No.
Have you been diagnosed with cancer?
No.
Tuberculosis?
No.
Okay, and what about any blood clots that you know of?
Nope.
Any infections anywhere? Okay, any severe uncontrolled bleeding that you can't stop anywhere? Have you ever been diagnosed with peripheral vascular disease?
Nope.
Okay, and we checked your sensation, so I know that is okay. And then there's just some areas we wouldn't do this over, such as your thoracic region or your carotid sinus, which is in your neck.
Okay.
Okay. So from this, I've determined that you are appropriate to perform this treatment. So we're going to go ahead and set up and get you started. Okay. So and I also want to give you this bell. So one of the things that we want you to feel with this treatment is a strong but comfortable tingle.
Okay.
Like I said, you shouldn't feel anything other than that. If you do, let me know. If I have to leave for a second, you can ring this bell.
Okay.
So we have our machine right here. And these are our pads we're going to use today and our medication. So the first thing I'm going to do is I'm just going to clean off the area that we're going to use.
Okay.
Okay. So we want to make sure we clean the area off with alcohol. This helps the pads to stick to that area.
Okay.
Great. You comfortable?
Yep.
Okay. So now we're going to go ahead and drop the medication. And we are going to drop 3 milliliters of the dexamethasone. And we have this pad right here. And what we want to do is we want to make sure we put the medication on in a kind of a circular motion. This way we make sure that there's not a lot of medication in one area. If there is a lot of medication in one area, it can leak out, and we don't want that to happen. Perfect. So now we're going to place the pad on your skin. So the area right here that I understand that's pretty sore, we want to make sure we don't put it over any bony areas that can increase the risk for burning again. So you have 3 bones in your arm. There's that bone right there. So we're going to stick this right here away from that. Just want to make sure we press around the pad. You don't really want to press on the pad because that can, again, make that medication come out. Okay. And then we want to place the other pad about a hand's width apart from this pad. Okay, so now we can go ahead and hook this up. So the medication, like I said, goes in through an electrical current. You want to make sure that the lead, there's a positive and negative lead. This is the negative, this is a positive. Your medicine, dexamethasone, is negative, so you want to place the same current on that. So that's going to be a negative on a negative.
Okay.
This pushes the medication in. So we put the black on there. We want to make sure the metal is hooked onto there. And then the positive here. So black with medication, which is negative, red on the other pad, which is positive. And those are on correctly. Okay, so here is our machine. The first thing we want to do is we want to turn it on. Ours is on. And then we want to make sure these knobs up here, which is the current, are all the way at the lowest level. Okay, and our leads are in. Okay, and then we want to go to S1, which is setting our dosage of the medication. Okay. So this goes in at 40 milliamps per minute, and that's just how much medication is going in. Okay, then we want to turn it to the P, and that is going to show us what our current level is at currently. We want to make sure it's at that lowest level again. Then we can turn it to R, which is the amount of current that's going to go in. So now what we're going to do is you're going to turn this first dial, and we're going to turn it up, and that sets the current. And we're going to see it on here. Now this is when you'll feel that strong but comfortable tingle. And when we feel that, we usually want to stop. Now we do want to get up to 2 level because that's when the medicine starts to work.
Okay.
With your skin's a little fairer, so we probably don't want to go above 3. So between that 2 and 3 level is going to be the magic number. So we're going to turn it up slowly and just tell me if you start to feel that strong but comfortable tingle, okay?
Okay.
Feeling anything?
Yeah, I feel it.
Okay, we're still going to keep going up. All right, so we're at about that 2 level. So that is where we're going to keep it at today. You said you felt that strong but comfortable tingle, correct?
Yeah.
Okay, so we'll keep it at that. Now what you can actually do is you can scroll through this menu, and that'll show you your time. The time is
Okay.
set by how the medication goes in and the current level we're using, okay? So you can keep it on that, and you can just watch it as it goes, so you know how long. So this is how we set it up. Now, if we've had it on for the right amount of time, we want to make sure that it's done, and we can go ahead and turn it off. And then we will unhook you. And then we will take your pads off. How did that feel?
It felt okay.
Okay. Okay, now you may notice that you have some redness in that area. That's completely normal. If this lasts longer than 30 minutes, then you want to let somebody know. And you also want to make sure that you just clean yourself off. You can clean yourself off with some alcohol again, just to make sure that's off. Now, after this, you want to make sure you don't move that arm around too much. This can increase how much medication's moving around in that area, and we want it to kind of not go in too fast, okay? What you can do is you can ice that area if you need to, and we'll also teach you some strategies to use so you don't have to use that arm as much. You can use this arm. If you do have to pick things up with that arm, we want you to pick up with your palm up, so like that.
Okay.
That uses different muscles than that area back there.
All right.
Okay? Do you have any questions?
No.
All right. Well, great job. Thank you.
Thank you.